frequency ablation. Understand the radio frequency ablation. I will ask very simple questions. Just I'm giving you an example. A human being, okay. So don't you consider it as a human being. Now there is a electrical conductor. The person is on the earth. He touches this wire. So what is expected to happen? A normal person is one side, he is arched, and he is touching one wire which is conducting the electricity or current. What will happen?
He get a shock.
He will get a shock. That means, what are the phenomena in a shock? First of all, as this home electricity is a low frequency electricity, and the human electricity, that means the electricity that is helping us for the conduction of the nerves, that is helping for the conduction of the electric current within the heart. Okay, so they are in the same frequency range. So what will happen? He will get a strong nervous and strong cardiac event. Cardiac event do not occur first. First what events is the nervous thing, and usually the sensation of shock in the nerves he will get. Okay. Then in severe cases, he might get a cardiac arrest as well. So these are the physiological effects. But apart from this, the person might get a burn in the finger. True? Why this burn? Because of the thermal effect of the current. So when a current is passed through a circuit, and within this circuit, say the current, then we have the resistance it is passing. Okay. Say I is the current, R is the resistance. What will happen? There will be a thermal effect of electricity, and there will be generation of the heat. So here it is the where you have increased the resistance by making it a coil, so it is generating the heat. Similarly, when it passes through some tissues, the tissue is also a conductor which is having a resistance. All right. So it will also cause or generate heat. And this heat will be utilizing for the lesioning of the nerve. Now, how to avoid this human effect or physiological effect of the current? Can anyone tell how in radio frequency we are avoiding? As this radio frequency current is a very high frequency current. This high frequency means how much high? It is usually 3 to 4 kilohertz. 3 to 4 kilohertz. So 1 cycle per second, that means the sinusoidal curve moving up and down. And usually normal home electricity in India, it is 220 volt, and that is the potential difference between two ends of the conductor, and the current which is flowing, it is the frequency of the current which is flowing, that is alternating current, that is in between 50 to 60 hertz. But here in radio frequency, what is used is a much higher frequency current. The advantage is that at that higher frequency current, it cannot stimulate our nerve tissues, neither it can stimulate our conductive tissues of the heart, but it retains the electrical or the heat effect of the current. Can anyone tell any other example of using same machinery in order to this generation of heat with the help of the radio frequency current? A machine that generates heat the same
cautery.
Yes, cautery. It actually it works on the same principle of the radio frequency. But the big difference is that our radio frequency is much controlled and sophisticated way we are raising the temperature close to the nerve. But the cautery is raising the temperature at a very high rate, and it is causing the shedding of the tissues, boiling of the tissues, protein degeneration, everything is it's causing. Okay. But our relation will be controlled of a specific size and very close to a nerve to a specific area. Okay, so that is the basic difference. But the machines, by principle of the same machines, they are not different. So let's see what are the components of a radio frequency machine and the details of the electricity. So, electricity a few important terms. First of all, what is direct current and what is alternating current? Can anyone tell?
In the alternating current, the direction of the current keeps changing. I
Yes.
mean,
Very simple.
while
If you are using a battery, okay, I put say a dry cell. So what is happening? So one side it is having a plus, other side of the battery it is having a negative pole. So if we connect it with a conductor, so current only flow with one direction. So positive to negative, the electrons will flow from negative to positive. That is the principle of the direct current. But when a current is generated in through the dynamo, say for example, whatever may be the mechanism through a dynamo, and what happens, the current will not be same. That means here the electrons are always flowing in the same direction. But there, for certain duration of time, these electrons will flow this direction, and then the flow will cease gradually, and then the electrons will flow to the opposite direction. So that is known as the alternating current. There are a lot of advantages of the alternating current over the direct current. That is why nowadays most commonly what we use is the alternating current, except for the sophisticated semiconductors where it cannot work with the alternating current. So in most of the semiconductors, there is a diode system that actually converts this alternating current to a direct current, and that is used. But in most of the major equipments, so your fan, your light, and everything, it is not the direct current, it's the alternating current that is working. What is the frequency of a current? Frequency of alternating current means the number of times by which the current is changing the direction. Okay. So usually for home electricity, I have told it is 50 to 60 times per second, but in radio frequency, it is 30 to 3000 to 4000 kilowatts per second. Okay. Now coming to the ampere. Ampere is the flow of the current. How much current is flowing through the conductor? Potential difference is measured with the help of the volt that actually states the difference of state between the two electrodes that allows or that determines how much current to be flow. What is the power or the work done by that current in unit time? Okay, and ampere is the measure of current. Volt is the measure of volt is the measure of
Still different, sir.
potential difference. And what is the measure of work done in
power.
unit is work done by power or work done in unit time. Same, you're right, that's the power actually. So now principles of radio frequency. Okay, we have discussed this part. That is what is the direct current, what is alternating current. We have talked about our domestic electricity. We have talked about our radio frequency electricity. So here in the radio frequency machine, the basic principle will be to change our low frequency electricity to a very high frequency electricity. So that is the basic principle. But that only changing the electricity is not enough. An RF machine have certain other properties that I will be telling a little later. But before that, you just understand the principle of radio frequency. RF or radio frequency involves passage of very high frequency current through a 27 gauge thermocouple probe. All right. So it is passed through a thermocouple that is 27 gauge. But here there is also a catch. The thermocouple is such that it can actually sense the temperature. That means it will deliver the current and it will sense the temperature. I will show and demonstrate the machine that will be very much clear to you. And this probe is passed through a 14 to 22 gauge cannula, which is having an insulated portion and having a tip portion. Let's see how it is. So basically, the needle tip is like this. Here we have a stem which is covered with an insulator, and we have a tip that is exposed. Okay, and through this needle, so say for example, everyone have you seen the Twinkie spinal needle? So what it is possible that instead of the stillet, we are putting the thermocouple probe that will supply the radio frequency current, as well as it has a measuring equipment that can measure the tip temperature. So that is the basic principle, that it can measure the tip temperature. By that way, it can control the radio frequency current. So it can measure the tip temperature and it is passed to the needle. And the needle is kept close to the nerve. So the circuit is like this. That means one side has the needle, then it is close to the nerve, and one side we have the ground pad. And this completes the circuit. And the input current is 50 hertz, whereas we are getting the 300 kilohertz current as the out. So there will be no physiologic effect, but there will be generation of heat around the tissues close to the tip. Remember, as it is by the thermal effect of the current within the tissue. So the tissue is heated first, and from the heated tissue, the heat is transferred to the first to this tip, okay, to this thermocouple, this tip of the needle, and then it is heating the thermocouple. But as they are very small volume, okay, very small mass, so they all becomes very instantaneously within few milliseconds. It can sense the tip temperature, it can correct the tip temperature. Okay, so by that way, we actually get the tip temperature recording, and the machine is adjusted in such a way. The machine has certain mechanisms. What it can do when we have set the temperature at 80 degrees Celsius, and we are actually finding that the tip temperature is close to 80, then the machine will reduce the power of the electric current to keep the tip temperature at 80 degrees Celsius to our set time. That means if we set the time previously to 120 seconds, the machine will keep the tip temperature at 80 degrees Celsius by reducing the power of the electricity. Once it reached electricity, 80 degrees Celsius, it will not instruct the machine to give more power of the current and to raise the temperature to 90. Rather, it will reduce the power of the machine and it will keep the tip temperature at 80 degrees Celsius. So that at 80 degrees Celsius, the tissues around it, as they are heated, so and if the nerve is closed, the nerve is also heated, so there will be formation of a lesion around the needle. Okay, so that is the basic principle of radio frequency. So first, RF lesioning involves the passage of the very high frequency of the current to a 27 gauge thermocouple probe. Probe is passed to a 14 gauge to 22 gauge cannula, and depending on the area, we should select the cannula, which is insulated except for the tip. And then the high frequency alternating current is passed to the tip, and that will causing the heat generation through the electromechanical friction of the tissue. Okay, so what will happen? Due to this change in polarity of the current, the tissues which are ionic tissues close to the tip, they will start moving. And these tissues will have friction and they will collide with one another. And they will generate heat. And this heat generation is dependent on various factors. Among those factors, it is how much current you are giving, then which type of tissue it is, whether they are very insulated tissues or not, where current cannot pass properly. If it is within the fat, then what will happen if the current cannot pass properly? So the chance heat generation will be less. Similarly, if it is close to a vessel, then what will happen? The vessel will drive away the temperature. Even it is generated, so it will drive away. So the temperature will not reach the temperature when kept easily. So these are the ways by which actually determines the tip temperature. So thermocouple probe is not heated by itself. It is actually dissipates the heat generated at the surrounding tissue. Thus, the heat is totally controlled by the operator. The lesion generated is the shape of a matchstick head, which is having a diameter of 2 to 4 millimeter. Beyond the distance electrical field, beyond certain distance, that means up to 2 to 4 millimeter, there will be the generation of the heat. After that, what will happen? That the heat will be dispersed, dissipated. And then what will happen? No lesion will produce beyond 4 millimeter. Okay, so the lesion size will be fixed. And the tip temperature, we keep something between 65 to 90 degrees Celsius. In case of conventional radio frequency, that is our desired temperature for various nerves. So by that way, we can actually do the lesioning of the nerve. So if you have any question regarding conventional radio frequency, please ask me.
Yeah, can I ask?
Yes.
I don't know whether I should be asking in this lecture or not. Whenever we do a conventional radio frequency, there's something known as sensory stimulation and motor stimulation. Can you just explain that? I mean, before doing the RF.
So basically, this RF generator has various functions. Okay. So we are discussing here the main function, that is the generation of the heat. But remember, to understand that whether we are close to the nervous tissue or not, the machine has coupled two other mechanisms. One is the sense, one is the sensory stimulation and motor stimulation, and one is the impedance measurement. So by which we can understand these are the two additional mechanisms the machine has to locate the nerve. So what is that? The machine can give a 50 Hz alternating current at a controlled manner for the sensory stimulation. That means it will not be effect on the heart, but it will be having close to the effect to the normal electrical effect close to the tip. Usually, it is given at a pulse. Remember, it is given in pulse. So for the motor stimulation, it is given at a rate of 2 Hz and the potential difference of 2 volts. Remember, with a 2 volt, you cannot give electric shock in anyone. But when you are close to a nerve, and we are giving a 2 volt potential difference close to the nerve with 2 Hz of frequency. That means it will be or not be a continuous current, but it will be an intermittent current at a frequency of 2 Hz. That means twice a second. So it will produce the motor contraction. But remember, this current is not the radio frequency current. This is our normal electric current, direct electric current. All right. Similarly, in a close to the nerve, if we can give the sensory stimulus in 0.5 volt and 50 hertz, that is 50 times a second, and that is 0.5 volt. Remember, one normal cell, dry cell, gives around 1.5 volts of current. So it is 1/3 of a dry cell potential difference. So if we get that minute electricity, it can cause paresthesia. So these are the parameters that is incorporated within the radio frequency generator, so that before doing the radio frequency, the pulsed or conventional, we can check whether we are close to the nerve. And that is what is the sensory and motor stimulation that is done before the procedure, the conventional radio frequency. All
Yeah.
right?
Yeah. So before we do the RF, we should try to achieve that our needle, the sensory stimulation is achieved at a 0.5 volts and 50 hertz.
Yes.
And to prevent motor damage, at 2 volts also we should not be getting a motor stimulation.
Yes. What is happening? See, it is not true for all areas. Say we are doing for a facet joint. Then we are close to the median branch of a facet joint. Now, here we are expecting a contraction of the multifidus muscles, but we do not want the contraction of the leg muscles. Okay? Because
Yeah.
it is inherent that the multifidus will be contracted. So,
Yeah.
in the motor stimulation, we'll be checking whether the multifidus contraction are present or not. And in the sensory stimulation, we'll be checking whether we are getting the paresthesia along the same nerve or the same area or not. So that is how, depending on the nerve, we should check. For example, for the mandibular division. So it
Mm-hmm.
has happened that master contraction we will be able to see. And that is expected. So depending on the area, we should conclude that whether I am in right position.
Okay. Thank you.
All right. Now, going to the next part. Now, the concept of pulse radio frequency. The initial part, it was only the conventional radio frequency that has been used. But it has been found that in certain areas, especially in case of cervical DRG, close to the cervical DRG, if the radio frequency is done at a lower temperature also, it is giving a pain relief. That means even at a temperature of 42 degrees Celsius, which is just 7 degrees above our normal human temperature. If we do the radio frequency, then we are finding that there is pain relief, but with no thermal listening power of that planet. And this phenomenon or this invention has led us to incorporate another mechanism within our this radio frequency generator that is known as the pulsed radio frequency. What is pulsed radio frequency? Here, even with the reduced power, we cannot achieve such a low temperature. So what is done? The electricity is given in pulse. That means, say this is 1 second. Then for certain milliseconds, we'll be giving the electric current. Then we'll be giving a pulse. Again, for certain milliseconds, we'll be giving the electric current. Then we'll be giving a pulse. So we'll be giving the electric in a pulsed manner. And here we'll be keeping it for a longer period of time. It has been found it causes some change in the nerve. Some says it is because of certain gene expression. Those studies are on this matter, but still we are not sure what is the exact mechanism. But it has been found it causes a neuromodulation, and that causes a pain relief. So what is happening here? The frequency of the current remains the same. By reduction of power, the temperature can be controlled. By frequency remains the same. Whether the current is continuous or not, three factors are there that can electrically or within the circuit can control the tip temperature. So here in the pulsed radio frequency, the current is given in pulsed to keep the probe at a constant temperature. So what is done? Say there is a 20 millisecond pulse of electric current. Then there is a pause of 480 milliseconds. Okay. Then again there is a 20 millisecond pulse of electric current. Then there is a pause of 480 milliseconds. So that means in 1 second there will be 220 millisecond pulse. And that is known as the pulsed electricity. Okay. So high frequency current, but delivered in pulses. And in between there is a complete silence, and this is known as the pulsed radio frequency. It is useful when it is done close to the cervical DRG. It can be useful for the other nerves as well. So here the temperature is such it cannot produce any heat lesion, but it can produce lesion which is a non-thermal lesion. So it is not a neurolysis. Remember, cold radio frequency, ablation, conventional radio frequency, all causes a neuroablation, but it is not a neuroablation, it's a neuromodulation. Okay. So here it is because of the magnetic effect of the current, and the thermal radio frequency occurs around the shaft. Remember, at the tip, the radio frequency heating effect is minimal, but this effect, that means the electromagnetic effect, is also high at the tip. So while doing a radio frequency, what we are saying that we should keep the tip close to the nerve. We want to keep the tip parallel to the nerve, so that around the nerve, the tip, there is 4 millimeter lesion, and within the lesion zone, the nerve should come. But here it should be close to the tip. So that is the lesion around the conventional radio frequency probe. So what will happen? So actually, there is a zone around the needle. So what happens in conventional radio frequency? Say first is the red. Say around the needle, close this area is first heated, and this area is heated maximally. And say it is heated at around 80 degrees Celsius, as the tip is heated kept at 80 degrees Celsius. Then a little away from it, it is slightly reduced, and it is not like a stepwise manner, but it is continuous. So you can say it is at 60 degrees. Further, a little away from it, the heat is slightly less. So it will remain at say 50 degrees Celsius. In that way, it will produce a definite amount of area of lesion around that tip. So this is, once this equilibrium is formed, that means the innermost is 80, rest gradually decreasing up to 37 degrees Celsius. Okay, then this normal tissue at 37 degrees Celsius. So once this equilibrium is formed, even if you increase the time of your lesioning, the lesion size will not increase. Even if you increase the temperature up to certain level, the lesion size will increase, but after that, it will not increase, because again the problem will be the same. Here we cannot go beyond 90 degrees Celsius, because if you go beyond 90 degrees Celsius, what will happen? Here our principle is we should be close to the nerve. And if you go above 90 degrees, there will be bubbling of the tissue within the tissues. Okay? The water vapor will start forming. And what it will make, if there is gas, it will just, I should say, make the space. There will be a space of gas layer will be formed between the needle and the nerve. So ultimately, it will not be of benefit. So we cannot increase the temperature at any extent. Okay. The usual range is between 65 to 90 degrees Celsius. And most commonly, in most of the areas, we do at 80 degrees Celsius. In some sensitive areas where there are close other nerves, or if we are doing a mixed nerve like mandibular, where there is a possibility that motor weakness might occur, in those cases, we'll do a little lower temperature. Okay, so that is how the equilibrium is formed around the radio frequency tip. Please understand this principle, because otherwise understanding the cool radio frequency will be difficult. So everyone has understood this equilibrium part, and why indefinitely increasing the tip temperature will not increase the lesion size, and why the indefinitely increasing the time of lesioning will not increase the lesion size. Everyone understood this component?
Yeah, just can you just repeat our lesioning time we should keep around?
Yes. Initially, when the tip is being heated, initially the tissues around the tip, close to the tip, the temperature will be increasing in that part. So if we have set the machine at 80 degrees Celsius, the tissue close to the tip, they will reach first the temperature, desired temperature, that means 80 degrees Celsius. Okay? So that is the first tissue that will reach to the 80 degrees Celsius. So it is the needle and this first layer of tissues that will reach 80 degrees Celsius. Now, once it is at 80 degrees Celsius, at the same time, when it has reached 80 degrees Celsius, the tissue slightly away from it will be a little low temperature. So say it is at 70 degrees Celsius. Okay?
Yeah.
Because the heat is generated at this part and then the heat is transmitted here. So it is at slightly reduced temperature. And furthermore, in the distance, say here, it is at, say, 50 degrees Celsius.
Yeah.
And in further distance, these tissues, say these tissues is at 45 degree, and beyond that, all at 37 degrees Celsius. Okay, here the tissues are 37 degrees Celsius. So there is no lesioning. Usually, above 42, the lesioning starts. Below 42, there is no lesioning. In that area, there will be no lesioning of the tissues. Alright. So once the equilibrium is reached, then even if you increase the time, because heat is being dissipated, heat is being dispersed. So this area will always remain. This will remain always at 80 degrees Celsius, and this will remain always at 45 degrees Celsius. Even if you keep it for 1 minute or 5 minutes, it doesn't make a difference. That is why beyond 90 degrees Celsius, it is said there is no effective increase in lesion size. So once you have done at 80 degrees Celsius for 90 seconds, sorry, not 90 degree, but 90 seconds, after 90 seconds, there is no use even if you increase the lesioning time. The concept is clear?
Yeah. So we should lesion it just once, or maybe we can do a repeat lesioning. I mean, with the needle still in place after a break of.
Yes. During repeat lesioning, what we do, we slightly reposition the needle. Either by rotating the needle, because these needles most of the times we take a card's needle. So once we rotate the needle to 180 degree, so needle moves a little away. Okay. So in that case, the new tissues are incorporated. Okay. So we are not lesioning at the same point, but we are lesioning to the close areas. That is why by repeated lesioning, we are trying to increase the lesion size. Okay. It is not by temperature, but by slightly rotating it. Alright, so in that way, it can increase the lesion size. We will discuss on that. What are the ways by which we can increase the lesion size? But before that, let us discuss a little bit about the conventional and pulsed radio frequency. In conventional radio frequency, we are producing the heat lesion. We can go up to 90 degrees Celsius. In pulsed radio frequency, it is the electrical field that is producing no lesion, but that is producing the neuromodulation. In pulsed radio frequency, the temperature is not allowed to raise beyond 40 degrees Celsius. The electrical field produces some punch in the capacitor of the small diameter nocive fibers, thereby the signal transmission is stopped. But remember, in this part, there are a lot of theories, but still, what is actually working, what's the mechanism, a lot of things is not still explored properly. Coming to the part, what is the advantage of it? It stimulates, there is no nerve damage, it is safe, there is no differentiation pain following the degeneration because there is no nerve degeneration. It is neuromodulation, not nerve degeneration or nerve ablation. So, conventional versus pulse. In conventional type of RF, nerves are degenerated in future. An average pain-free period may be usually 1 to 5 years. Sometimes it can range between 3 to 4 years as well. In the pulsed radio frequency, the nerve is repaired or it is modulated. An average pain-free period is 4 to 25 months, so 24 months. So in pulsed radio frequency, the duration is less. Now, let us discuss about a new type of stimulation. Sorry, not stimulation, but radio frequency ablation that is known as the cooled radio frequency. So everyone of you have understood this conventional versus pulse portion? Pulse radio frequency and conventional radio frequency. Then I will go to the cooled radio frequency. Now, can anyone tell at which temperature the cooled radio frequency we do? Any idea? At which temperature cooled radio frequency is done? Remember, though the name is the cooled radio frequency, but the radio frequency is not a cooled radio frequency, it's a thermal radio frequency. In thermal radio frequency, we have found a drawback that beyond 2 to 4 millimeter, the lesion cannot be generated. To overcome this problem, another new technique is been devised. What is that? Now, you just remember few basic principles that the needle is not heated, the tissue close to the needle is heated. And this tissue close to the needle is heated by the current that is flowing through the tissues that causes movement of these particles, that causes friction, that generates heat. Now, once here in conventional RF, it goes into the equilibrium that I have shown. That means the closed tissues, their high temperature, then slightly lower, then slightly lower. So it cannot go beyond that. But what if we can do another technique that instead of keeping the tip at 80 degrees Celsius, we just incorporate some new mechanism. And what is this new mechanism? In this new mechanism, we just introduced one water channel from here and water channel from here. So, through this water channel, from one side, we will be putting water inside, and from the other side, we'll be taking the water out. So, what it will do? It will reduce the pin temperature. But in that condition, what it will do? The equilibrium will be slightly different. As the tissues close to the needle, they are not going beyond 90 degrees Celsius. So, the equilibrium that will be formed will be a little bit of different type. So what type of equilibrium it will form? Let's see. So let me draw for you what type of equilibrium it will form. It will be forming a different type of equilibrium. So say as we are flowing cold water through this channel, so the tissues that is close to the needle, they will be at 50 degrees Celsius. Now, the tissues, they are slightly away. They will be at, say, 70 degrees Celsius. Then we'll be having third stage of tissues. They will be at 80 degrees Celsius. Then say, arbitrarily, the next tissues, they will be at 90 degrees Celsius. Sorry. They will be at 90 degrees Celsius. Then as we are going beyond, then heat dissipation starts. So here, these tissues will be at again 80 degrees Celsius. Then again it will be at, say, 70 degrees Celsius. Then again it will be at 45 or 50 degrees Celsius. Then again farther away, it will be of, say, 40 degrees Celsius. So here the equilibrium is slightly different, and this goes much beyond 2 to 4 millimeter. You understood the concept? Just by flowing water close to the needle, here we have achieved another goal, that here instead of increasing the temperature, so here we are actually able to keep the tip temperature low and forming a different kind of equilibrium that is actually much larger compared to the lesion that is produced by the conventional radio frequency. And this is known as the cooled radio frequency. So in cooled radio frequency, the tip temperature is kept around 60 degrees Celsius, not 80 degrees Celsius. Because then this type of lesion will be formed. So tip temperature is controlled with the circulating cold water at room temperature. So 30 degree water will pass. Then what power of the radio frequency remains high, large size of the lesion will be produced, and this lesion will be a spherical generation. So this is the actual generation of circuit or generation of the heat dissipation diagram around the needle tip. So it will cause a 5 times larger volume of lesion around the tip, and thus it helps in increasing the size of the lesion. Now, what is the advantage of increasing the size of the lesion? For example, in certain areas, say we are doing the radiofrequency ablation of the sacroiliac joint, where there are multiple nerves that are coming close to the sacroiliac joint from different areas. So here what we have to do? We have to do multiple conventional radiofrequency lesions for the relief. But in those cases, if we do just 3/4 sparse radiofrequency, cooled radiofrequency lesion, as the lesions are larger, we can work actually 5, instead of 5 lesions, we can do 1 lesion. So if you have to cover a large area like sacroiliac joint, like genicular branches of knee, where the nerve location is not very consistent, then this cooled radio frequency is of much help. And that is how the cooled radio frequency is helping us, and this radio frequency has been promoted against. So advantage over that, it takes a larger volume of area, it having larger distal projection, and it is angle independent. I have told in case of the conventional radio frequency, as it is a cylindrical shaped lesion, you have to keep the tip parallel to the nerve, or just crossing to the nerve. If you keep only the tip, that means if it is there and we are just tangled at the tip, so the lesioning will be minimal. We want the nerve to remain close to the shaft. But here, even if the nerve is close to the tip, it will take the lesioning within that area. So it can, as it covers a large area. So cooled radio frequency is one way of increasing the lesion size. Now, there is another way of increasing the lesion size that is known as the bipolar radiofrequency. Now, but before going to the bipolar radiofrequency, do you have any questions regarding the cooled radiofrequency? You can ask me.
No.
Yes.
No question.
Okay, fine. Thank you. So let's go to the bipolar radiofrequency. Remember, bipolar radiofrequency is another way of increasing the lesion size. So here what is done, instead of a ground pad, okay, we will not be using the ground pad. Rather, the ground is connected to a second needle close to the first needle. That means, if, say, this is our tissue. Now, we have put two needles, one here and the other here. So what will happen, when the lesion will generate, the lesion will be of a little bit of different shape and type. So this lesion, with what will be generated, will be a dumbbell-shaped lesion. Okay, so it will be like this. It will be a dumbbell-shaped lesion. It will be a dumbbell-shaped lesion. Okay, so any structure within that part will be also included with that in that lesion. But remember, you have to be close for having a continuous lesion. Otherwise, in between, there might be an area where the temperature is very low. You have to keep the probe close, usually within 5 millimeters of each other. And in some cases, if you are using a higher power, you can keep it slightly away as well. But remember, in this lesioning, the lesion size surely increases. Okay, so bipolar radiofrequency is another way to increase the lesion size. Clear the points? Okay. So remember, there is another option also in the machine that is known as the multi-channel. But remember, multi-channel means the machine is providing two needles, but here each needle is completing the circuit with the ground pad. So it is equivalent to doing the lesion twice. But bipolar is not equivalent to doing the lesion twice. Clear? So that is how bipolar and multi-channel is different. Now, how many types of the RF cannulas we have? We have straight tip RF cannulas, we have curved tip RF cannulas. These are the curved tip RF cannulas. Now, according to length-wise, usually we have three types of lengths: 5 centimeter, 10 centimeter, and 15 centimeter. And you should have the adequate probe for the lesion. Now, according to the size of the needle, we can get 14 gauge, that is a thicker needle, to up to 22 gauge, smaller needle. Most commonly, we use the 20 or 22 gauge needle. And so, these all types of thickness of the needle are possible. Then we have the size of the exposed tip. So, exposed tip usually commonly used are the 5 millimeter, 10 millimeter, and 15 millimeter. But it is available from 2 to 15 millimeter active tip size is available. So, according to the area, we should choose our probe. And now there are some new probes is invented where after putting the probe, you can just extend like this, trident cannula. So these are the modern probes. These are helpful in increasing the lesion size. Here, the three lesions will be produced, one in each side of this trident. By that way, it will increase the lesion size over a conventional radiofrequency lead. Okay. So these are the different shape cannulas, and this shows the bipolar radiofrequency. Okay. Now, time, function, lesion size. This is one graph. This I have already explained to you and told to you. So initially, with the increase in time, as long as it is not reaching to the equilibrium, that the experiment is done 45 degrees Celsius. So up to around 60 degrees Celsius, the lesion size is increasing, and after that, there is no effective increase in the lesion size. Okay. So how we can increase the lesion size? First of all, increasing the gauge of the needle, increasing the time up to certain level using cooled radiofrequency, using bipolar radio frequency and using the newer cannulas, as I have shown the trident cannula. So these can actually increase the lesion size. Now, to confirm the needle placement, as I already told in one question of one of the students of yours actually, so here we can use either ultrasound or the CM guidance for the placement of the needles. That will increase our accuracy. We can do the sensory testing and motor testing, as I've already told, and we can check it with the sensory motor dissociation as well. So these are the ways by which it is possible. But here, for the tip, sensory motor dissociation is not very active way, but these three are very good ways. That is the motor testing, sensory testing, and the placement under guidance. So these are the ways by which we can actually confirm the needle placement. Now coming to the indications of the conventional radio frequency. So it can be used in lot of areas, in almost all sympathetic ganglions, except the celiac plexus and the suprahypogastric plexus, as they are large enough to cover even with the cold radio frequency. So it can be used in the Glaserian ganglion, it can be used in the Phenopalatine ganglion, it can be used for the blockage of the third occipital nerve, it can be used for the cervical facet denervation, it can be used for the T2 T3 sympathetic ganglion, it can be used for the splanchnic nerve. We cannot do celiac plexus, but we can do the splanchnic nerve blockage. We can do in the lumbar sympathetic block. We can do block the lumbar facet. We can do block the thoracic facet. We can do block the sacroiliac joint and multiple other things. So these all things are possible with the help of the radio frequency. Pulse studies, they are useful when in close relation there are other lot of important motor structures like cervical DRG, lumbar DRG, as they are close to the motor component as well. So there it can be used. It can be used for the suprascapular nerve as it has a significant motor component as well. But nowadays, if you are going only to the sensory branches, to the spinoglynoid notch, which are nowadays we are doing to the ultrasound guidance and we are doing at the synovial notch. So in those cases, we can do conventional as well. But otherwise, on the suprascapular nerve, as it is a mixed nerve and has a lot of motor functions, so there the pulse radio frequency is the choice, similar for the intracostal and the occipital as well. Okay. Now coming to the cool radio frequency. As I told, cool radio frequency is preferred where our nerve location is not very precise. For example, sacroiliac joint, genicular nerves of the knee, articular branches of the hip joint, articular branches of the shoulder joint, and sometimes for the lumbar facet joint also, cool radio frequency can be used. Now, bipolar radio frequency can be used for the lateral branches of the SI joint, similar, almost similar to the cool radio frequencies actually, where our location is not very accurate. Then we can use the bipolar radio frequency. As the bipolar radio frequency, the lesion size is slightly more.